What's wonderful to see? It's wonderful to see that you all have started exercising and exercised for 10 minutes before my talk. And I see that you've been sweating, laughing, and that's wonderful. But I want you to do one more thing, and that is say a great big aloha to everyone who's out there. Say it really loud, make it very loud because that's an exercise, one more exercise for you to do because people with Parkinson's disease have a problem which is called microphonia, which means that people with Parkinson's disease tend to talk really soft. And that is not good. We need to exercise our vocal cords and talk loud. That's an exercise that should be done regularly. There's another thing I'd like you to do is raise your hand. And this will be a talk in which I'll be asking you regularly to raise your hands because I want to make sure that you're participating. And that's what one thing that doctors we do is when we want an audience to participate, we give them questions that they have to answer. So here's my first question for today. What are the three cardinal features of Parkinson's disease? And I expect all of you to know at least one of the features. So how many of you think that shaking, a tremor, is one of the cardinal features of Parkinson's disease? Okay, I see that, let's see, there's about 13 of you who think that shaking is one of the cardinal features. What about unsteadiness, postural instability? How many of you think that's a cardinal feature? Okay, not so many. I see that 1, 2, 5 of you think that unsteadiness is one of the three cardinal features. And by cardinal features, we mean the features that are most indicative of Parkinson's disease. What about slowness? What we call bradykinesia. Okay, 1, 2, 3, 4, 5, 6, 7. And stiffness. Okay, one more, that's 8 people that say that stiffness. How many, oh, and we all are worried about impaired smell these days because of course that is a sign of COVID. How many of you think that impaired smell is a cardinal feature? 1, 2, okay, there's 3 of you. And fatigue, sleep problems, abnormal dreams. 1, 2, 6, 7 of you. Okay. And constipation, which is a common problem in seniors. Let's see how many. Okay, 4 of you think that's one of the cardinal features. So let's see what the answer really is. The 3 cardinal features of Parkinson's disease are, and as described 100 years ago by a person named Mr. Parkinson, is the resting tremor, the shaking of the hand that we all know is a very common feature of Parkinson's disease. Secondly, the bradykinesia, the sense sometimes that when you're walking that your feet are stuck to the floor and that you're walking very slowly. And then the third cardinal feature, muscle rigidity. And when the doctor checks you for what we call cogwheel rigidity, when they try to bend your elbow up and down, what they're checking for is cogwheeling, which is probably a combination of a tremor together with rigidity. So let's look at some of these other, well, these were, there were 7 features and 3 of them are, what about some of these other features? Well, these days we talk about 4 cardinal features. And the 4th one is unsteadiness or postural instability. And that is a very typical feature later in the disease, not so much early in disease. So a typical feature is when you're standing in front of the refrigerator and you're pulling the refrigerator door, be careful not to fall down, because once you lose your center of balance even a little bit, your balance is going to be much poorer as your Parkinson's disease progresses. Now, these other 3 features, impaired smell, sleep disorders, abnormal dreams, and constipation, they're fairly non-specific. We see these problems in people who don't have Parkinson's disease. But there is an interesting thing, is that these 3 features are now recognized as common features before we make a definitive diagnosis of Parkinson's disease. And that's what we now recognize as the PARS syndrome, Parkinson's associated risk syndrome. These symptoms are seen early, usually before we make a definitive diagnosis of Parkinson's disease. Another question: which of these following interventions can slow down the progression of Parkinson's disease? Now, that's a little bit different from saying, how do we treat it? We can treat it and make the tremor less, but how do we actually slow down the progression, which means that we actually would decrease the rate at which the disease gets worse? How many of you think that levodopa does that? And of course, we all know levodopa as Sinemet, a long established and still the best drug for Parkinson's disease. How many of you think that Sinemet actually slows down the disease? Okay, there's 8 people that think this might be slow down disease. How about deep brain stimulation? Now, deep brain stimulation is an increasingly common procedure, particularly for people in the earlier stages of Parkinson's disease. This deep brain stimulation slows down the rate of progression. How many people think this slows down? Okay, there's only 3 of you. And how about something you just did at the very beginning of this talk, before this talk, exercise? Does exercise slow down the progression of this disease? So Parkinson's disease is a progressive neurodegenerative condition with no cure. But does anything slow it down? And the answer is aerobic exercise. Aerobic exercise is well established as being important to slow down the rate of progression of the disease. And now, in these days of Zoom, you can go to the Parkinson's Disease Association website and do virtual exercising, either in events or at your own schedule. Here's another website. PWR, Parkinson Wellness Recovery. This is a long established organization, started up by physical therapists, and their focus is entirely on physical therapy and exercises for people with Parkinson's disease. And they state research continues to show that exercise is a proactive and positive way to combat Parkinson's symptoms. Another organization, LSVT, which originally focused on speech therapy and was an organization founded by speech therapists, but they also have LSVT Loud, which focuses on exercise. And more recently, many Parkinsons have found the joys of boxing. And Rock Steady Boxing is an organization that is around the world now with very good results in those who participate. Now, here's a person who has sold 1 million books and, yes, 1 million books. And the way to sell 1 million books is by being very controversial. He's a leading expert on neuroplasticity, which is the concept that the brain can repair itself. The brain has its own way of healing, and this book discusses the various ways that our brain can heal itself. And he has an interesting story in the book that talks about a person who's had Parkinson's disease for decades, but still doesn't take medicine, but has participated in strenuous exercise that has really helped keep his disease from progressing. So when I was asked to talk about Parkinson's disease, it's actually not my area of expertise. I'm a geriatrician. I have a lot of knowledge about caregiving issues, frailty, cognitive impairment, but I've also been following COVID very closely. But I was fortunate to have just taken a review course in Parkinson's just the previous week, so that was able to help me out. And now we get to the question about what is the impact of COVID on people with Parkinson's disease? So I'm going to ask you some true false questions. Raise your hands. How many people do you think, is it true or false that people with Parkinson's disease are more likely to get COVID? How many of you say true? Well, that is actually false, or the predominance of evidence at this point is that it's false. We do have good evidence that people with dementia are more likely to get COVID. But so far, there's not strong evidence that people with Parkinson's disease are more likely to come down with a serious case of COVID. Now, what if a person with Parkinson's disease actually does get COVID? Is it more likely that this person will become seriously ill? And the answer here is true. So Parkinson's disease is a disease in which your ability to maintain homeostasis, to maintain good health, or to recover from an illness is impaired. So a person with Parkinson's disease, it's not surprising at all that they are more likely to get seriously ill if they have COVID. Just like a person with Parkinson's disease, if that person gets a urinary tract infection, that person is also likely to get more seriously ill. Can COVID worsen Parkinson's symptoms? And the answer here is yes. So when I take care of patients in the hospital, when they become acutely ill, a lot of times we need to adjust medications because the Parkinson's symptoms frequently get worse, both during hospitalization and in the recovery period. Now, I'd like to talk about mask. So I'm talking in front of you who most of you live in a retirement community. And we all know that masks are a very important way of preventing the spread of COVID. Um, so what should you look for in a mask? So think of the 3 F's, which I'll describe in a little bit. The 3 F's are filtration, fit, and feel. And there's also the cost factor, but let's start off with filtration. What does that mean? Filtration means the ability of a mask to keep particles, droplets, and aerosols from getting through a mask. So we know that the strongest masks are really indicated for people who are extremely high risk of exposure to COVID. They need maximum filtration. And of course, that means healthcare workers. Now, among you here, you're not healthcare workers, so you may not need that level of filtration. Now, I did have a friend who said, can I just use a coffee filter under my mask? And I had to tell that person that a coffee filter is able to filter out coffee grounds, but is not able to filter out respiratory droplets. So the first question is, how strong is the filtration of the mask? Second thing is, how well does it fit? Of course, you see this lady here, the mask is below her nose. That's not going to help at all, no matter how well that mask filters, because the air is just going to go through because it just gets around the mask. So your fit of your mask has to be really good. And last, and this may seem silly, but you really have to have a mask that you feel comfortable wearing. It needs to feel good. Certain kinds of materials are uncomfortable and can cause rashes. People wear glasses. You need to find a mask that has a right amount of filtration, fits well, and that feels comfortable on you. So again, I'm going to ask you, what is my general recommendation for you here in senior living community? And I've already heard that almost a good 80 to 90% of you have been vaccinated. What is the appropriate mask for you? And I do see here out in the audience, there's one person wearing the mask up in the upper left-hand corner. That's a surgical mask. How many of you think that is the best mask for your setting? So I have a question mark there, and I need to tell you that surgical masks are not maximal at filtration. They are able to decrease the amount of respiratory contamination from coughing or respiratory droplets, but they are not extremely strong filters. The other thing about face masks like this is that the fit frequently is not perfect. So if the mask doesn't fit and you can feel the air coming in and out through the side, that's kind of like wearing a snorkel mask, which is high quality filter, but if it doesn't fit you well, the water is going to get in anyway. What about this mask in the middle? That's of the variety that's called the KN95 mask. How many of you think that is the best? Like, okay, I see a lot of you raising your hands here. And what is my answer here? It's actually a question mark. It's because the KN95 mask does have very good filtration. It does need to fit correctly. It does tend to mold well to the face if you get the correct size. But there's a couple of downsides of the KN95. And one is that they're only meant to be used for a limited number of times. In fact, optimally, they should only be used once. Um, they certainly are not good for prolonged use, and you'll need to buy another one or keep a supply of them. And these masks are relatively expensive. There's a lot of fake KN95s that, anything that costs less than $1, it probably is not. It's probably a counterfeit mask because these masks are relatively expensive. What about face shields? Are those the best thing to use in a senior living community? And I don't see any hands there, and you're all correct. It's not the correct thing because of a face shield by itself is not, it does not fit at all. And even in grocery stores, you'll see people use shields, and optimally they should be using a mask as well. Now, what about the mask in the lower right-hand corner, which has a gadget on it, and that is called a vent. So this mask, the CDC definitely recommends do not use. And the reason they say that is because the vents tend to cause consolidation and precipitation of droplets, and actually increase the risk of having keeping COVID close to the mask and increase the risk of spread. So the remaining thing is, yes, I recommend a high quality cloth mask. You can see these masks are high quality cloth, and they do accommodate a filter underneath, and they are adjustable and fit well. So overall, I think for daily use in a senior living community facility in which you're practicing other measures to avoid COVID, this is probably the most appropriate mask to use on a daily basis. So I have a question for you. As a geriatrics physician, I realized that the caregiver is the most important person. And I want to ask you this question: is what's it like to be a caregiver? And you're the experts here. What's the hardest part of being a caregiver? Is it emotional strain? Is it feelings of isolation, lack of knowledge or skills, all of the above, or none of the above? That actually none of these are problems. So how many of you say? So I see a lot of, okay, emotional strain, feelings of isolation, that you're just all by yourself. How many of you? Okay, I see a lot of hands there. And lack of skills, a lot. And then, okay, you're all keeping your hands up and all of above. So I would like to continue talking with you. I think that I have a strong belief that we can combat our feelings of isolation, support each other emotionally, and share knowledge. And that's my hope with the website that I've developed. And I would love to talk with you about questions like, how did you become a caregiver? What's the hardest part? And how do you relieve stress? And what do you do to stay healthy? So thank you so much for asking me to give this short talk on Parkinson's disease. I've enjoyed meeting all of you. Thank you.